Hi, my name is Dr. John Repole from Jacksonville Health and Wellness Center. So this short segment, we're simply just distinguishing between what we call the reference ranges in lab work and say what we call the functional or optimal ranges. So when you get your blood work back and you start looking at the different ranges that are there, you're going to see your numbers and then you're going to see what's called the reference range. And in essence, reference ranges are put together from the mean of all the people who went to go get their blood work taken, and they kind of average it. So, like, for instance, the cholesterol levels in the United States, our low is going to be the high, say, in rural China, right? So they're based upon our population. But the problem is, right, is that our population is pretty unhealthy. So not a great place to look at comparisons. So there are new ranges that are out, and they're what they call the functional or optimal ranges. And I encourage you to really have your doctor who's knowledgeable about this, look at those functional or optimal ranges. So let's give you a couple of examples. You go and get your blood work taken, everything looks completely normal, but yet you feel horrible, right? But your blood work is telling you that everything is fine. So the doctor says everything is good, we'll see you back in a year. And the problem is the reference ranges are looking for pathology. So in other words, you're either normal or there's something wrong with you, and there's no shades of gray in between. So it's okay for the small percentage of people to be looking at those reference ranges, but for the majority of people, we all fall in between what we call those shades of gray in between, where there really is no name diagnosis. You're not there yet. As an example, let's say the reference range for glucose is between 60 and 100. And 1 year you're at 70, 1 year at 80, 1 year at 94. But because it's still 60 to 100, doctor will say everything is fine. But what's happening over the years, as the delta change over the years, what's occurring at that point is really you are little by little getting blood sugar dysregulation disorders. So whenever you have your doctor look at your blood work, advise them to use the functional or optimal ranges, and then of course all our patients here at this office, that is a courtesy that we provide. Whenever I look at somebody's blood work, we're always looking at those optimal and functional ranges and kind of giving you a second opinion, not just from a conventional standpoint, but from a holistic standpoint as well. Thanks so much.